The next panel on technology innovative strategies to reduce alcohol-impaired driving. We have three speakers. The first is Keith. I'm going to hopefully not butcher your name. Nothacker? Nothacker. Thank you. Well, not even close. CEO of BACtrack. Then we'll hear from Nadia Anderson. I think I can pronounce that more or less right. Manager of Public Policy, Road and Traffic Safety at Uber. And lastly, we'll hear from Steve Taylor, who's General Manager of the DC region at Lyft. As before, I think we'll let each of our speakers go and then open it up to questions. So, Keith, you're on.
Great. First off, thanks so much for having me here and inviting BACtrack to speak. We are honored to have private industry involved, and we have a lot of good information to share. So thank you very much. I'm going to talk about three main areas today. First, I just want to give an introduction to what we do. We make breath alcohol testers and wearable alcohol testers. And we've been doing this for a long time. So I'll give you a background there. We have some very unique data sets because what we do now connects with smartphones. So we have these unique data sets that we think are valuable to the committee. So I want to share some of that and give you a taste for that. And then third, you invited me, so we wanted to share information and some thoughts on what we thought could possibly make an impact in a very serious issue. So we have a lineup of various price breath alcohol testers, all under $199. These allow people to quickly estimate their blood alcohol content. You grab the device, and I have one here. It's small, portable, in my coat pocket. Very small, sleek, easy to keep in your pocket. Not trying to do the full sales pitch, sorry, but we did have to take what was a big, chunky law enforcement device and shrink it down so people would want to use them. You know, the same rules of purchasing for law enforcement with breath alcohol testers did not apply to us at all. So that's what we've had to do for a long time. I founded BACtrack in 2001. So at that time, the category didn't exist. Police had them. They've existed for decades. But really before companies like us came out and said, hey, this is something consumers can have to test themselves, it just didn't exist. I put this up, a goofy looking guy with the typical DMV drink chart. We say, how many drinks is 0.08? People hear about 0.08. It's sort of in the subconscious in America. How many drinks is 0.08? It's actually the most searched term for people to get to the BACtrack website. So many people are searching that, and we have some articles on that. We have a strong opinion on the chart. I hope nobody here on the committee had a role in creating that chart, but you're never going to pull that out in a bar. It's sort of kind of good for guidance, but food has a tremendous impact on your BAC. If I'm from Philadelphia originally, if I have a nice cheesesteak and then I have alcohol, my BAC is going to be radically different if I had a salad for dinner, even if I have the exact same number of drinks and the exact same alcohol content in those drinks. So, so that's sort of, maybe we call that the old school technology there. We group our technologies into three categories. So first, I've been talking about the breath alcohol testers on the left. We have standalone devices where you blow into it and it shows you your blood alcohol content estimate on the display. We have devices that connect via Bluetooth to a smartphone. We have fuel cell sensor technology. So that's the same type of technology used by police roadside in most cases. If they pull you over, make you walk the line, touch your nose, at the end they're going to give you that preliminary breath test. So same type of technology. People, even law enforcement, are sometimes shocked that we've been able to shrink that technology, reduce the cost, and make it available to consumers. So it is there. We have a lot of third-party testing validation from media. The New York Times did a study, compared our devices to these $900 police units, and found that our fuel cell technology was highly accurate. So that technology exists, and we've worked a long time to make it accurate for people to use. Just on that first technology also, I want to be clear that we provide these devices to educate people. We do not say, hey, have this device and see if you're a point oh 0.07. If you're point oh 0.07, you're safe to drive, and if you're point oh 0.08, you're not. That's not true at all. I've probably tested myself with a breath alcohol tester than most people in the world, I'd say. I've been doing this 16 years, and I know that point oh 0.07, you are impaired. You are not who you are. Even though you're below the quote unquote legal limit of point oh 0.08, your skills are impaired. People oftentimes that we test and we say, hey, you're a point oh 0.07, they say, holy cow, I would never drive with a point oh 0.07 or point oh 0.06 or point oh 0.05. So we provide these devices to try to educate people. Drink in your house with your family, understand how alcohol affects your body, understand how food affects your body, how different concentrations of alcohol, be it spirits or beer, have such a tremendous impact. Sorry, I'm going to move on here. The remote alcohol monitoring division, we just launched about a year ago a system where I can hit a button on my smartphone and it could make somebody anywhere in the world take a BAC test. Well, it would prompt them with their smartphone, notify them to take a breath alcohol test. It would use the front-facing camera in a smartphone. So you literally record yourself while you're blowing into the device, and that result, timestamp, date, time, location, goes to a monitoring party. So we have a lot of cases where it's husband-wife divorce case, and in order to see the kids, somebody has to blow into the device and send that to the other spouse. We have parents that are doing it. We had a parent that a son was only allowed to continue in the fraternity after 2 underage drinking arrests if he used this service while in college. So very, very broad spectrum of people using that remote alcohol monitoring. And thirdly, this is exciting as well, we have a wearable alcohol tester that I am wearing right now. If anybody wants to see my results, they're likely 0, but I'm not going to give away any secrets here. I took Lyft or Uber, yes. So we accelerated our development of that in part because there was the NIH Wearable Alcohol Biosensor Challenge. There was a competition to create that. That was government trying to encourage the development of these types of technologies. So we won first prize. That encouraged us to move fast. We won a cash prize from that, $200,000. That went right back into our R&D. So we are working hard to bring this product to market. Just a very quick timeline. I mentioned we've been doing this for a long time. 2001 is when we started. In 2004, the FDA determined that a 510K was necessary for pre-marketing clearance. That policy has actually changed since, so those are no longer required to market a breathalyzer for consumer use. Jumping way ahead to 2013, there was a lot of development of the technology, marketing, growing the industry up until that point. But in 2013 is when we were able to connect to a smartphone, and you get just a wealth of data from that. And then in 2017, here we are. It's one of those 16-year overnight success stories. Our products now are in Best Buy, Costco, Walmart, Walgreens, just a number of national retail stores. People ask us, who uses this product? If they're not familiar with a breathalyzer, people say, who would use a breathalyzer? And truly the answer is everybody, anybody that consumes alcohol or people that know somebody who consumes alcohol in a family. So it's a very wide spectrum of people that are purchasing these products to test themselves or to test others. You have social drinkers that just want to stay safe. You have serious users that somebody in the family might have an alcohol abuse issue, alcohol use disorder. Maybe they've been arrested for a DUI before. Maybe it's some other serious issue. Maybe they are in a profession where if they get one DUI, they lose their license. And then a lot of parents as well. And not just parents, we have businesses, schools, hospitals, clinics, just a lot of different groups will use this technology that's now available to purchase. I show this, so this is one of our displays in Costco stores, and below is our display in Best Buy stores. And I really have to give it to these retail partners that took the risk on this category, and that now when people go in, when millions of people go into stores, they're seeing these big advertisements for safety devices. It's sort of an amazing thing that just private companies are promoting this and willing to take the risk and people are buying these in quantities that it's sustainable at a retail level. Section 2, I'm getting into some of our data. And this is exciting because, like I said earlier, these data sets haven't existed before. And now, because we have people using our devices with fuel cell sensors that are connected to smartphones, we're able to anonymize this data and see it and draw conclusions from it. So this is from one of our BACtrack consumption reports. And we are showing the average BAC by day of week. And then on the right, the percentage of tests with the BAC over 0.10. So on one hand, it's amazing. On the other hand, it's not surprising. But our data closely matches the NTSB highway fatality data. So we're seeing that people are clearly binge drinking, especially between midnight and 4 a.m. That's when the fatalities occur. And those same people, those same groups are actually willing to test with the breath alcohol tester because we're seeing it there. I'm going to jump ahead to the next slide. Here is the NHTSA data, and again from 12 to 4 a.m. Friday, Saturday, Sunday, you're seeing people binge drinking. It's not surprising, but for the first time ever, we have the data and we're in contact with these customers. We can send people push notifications. We could trigger something else within the app if we see something at a certain time. We are a privately held company. Our mission, we have to reinvest in our technology and sustain ourselves. So that's not what we can afford to do. But there's certainly opportunities to speak with the customer directly through the smartphone at the time of impairment. Another thing we see, and we built into our app after a couple years of having the app, we see people's guesses. We had so many people guessing what their BAC was out loud before they took a test that we said, wow, we probably need to build this in. So while the device is actually warming up and making sure there's not residual alcohol in the sensor, there's a warm-up time before somebody blows, we ask people, what do you think your BAC is? So the user can actually see how their guesses actually get better over time. The more they use the device, the better they're able to estimate their own alcohol level. And then we can see that aggregate anonymized data as well. We can see, hey, overall, after X number of usages, people get more accurate in understanding their alcohol level. So for people like me and us in the industry, this is pretty exciting stuff that we can help people, educate people. And these are people that are not forced to buy our device. There's no law here. People want to use this. So it's pretty exciting. Last year, the Colorado Department of Transportation came to us and they were interested in doing a study where they gave away smartphone connected breath alcohol testers. We said yes, 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 yes. That was an amazing thing for the government to take that type of an initiative and do that study. So these numbers couldn't have been better if we had written them ourselves. We did not. This is from the Colorado Department of Transportation. 84% of participants agreed that owning a smartphone breathalyzer lowered their risk for a DWI. 82% agreed anyone who regularly drinks should own a breathalyzer. These people are not paid. These are unpaid people that just were given a product and used it. And they could have said, no, this was stupid, go away, that was fun. Overwhelmingly, they said, hey, this is a valuable thing because it educated them. It taught them how alcohol affects their body. And when you have this type of device, safety is more front of mind when you're able to test if you have it in your car or on yourself. We've done a number of surveys. This is not with our customers. This is just a broad range of people that consume alcohol. And if you look at that second stat there, 53% of people don't know how many drinks it takes to reach 0.08. I'd say the other half of people are probably lying. They probably don't know either. People just don't know. So there are still a lot of questions. The industry has come a long way, but there's still so many questions about how alcohol affects the body. What are these numbers people talk about, 0.08? How long does it take me to sober up? People think that body weight or other factors really impact how fast alcohol is eliminated in the system, and that's more about the absorption. So there's some biology there that people really have no clue about. We have noticed that by having a number in front of people, if they're in a social setting and people are drinking, if you test, you have an excuse to not drink and drive. You can say, hey, I'm a point oh 0.05. If I have another drink, I'm going to be over the legal limit. Or I could say to you, hey, you're too high. I just saw in your result, you shouldn't be driving. Um, that puts a quantifiable number on it. And especially with smartphone connectivity, you have this big, nice display that's in your face and people are used to looking at. So before, people could just say, hey, I feel fine, I'm good, let me go home. Maybe they're talking fine. So sure, you let them go home. Now it's different. Now people have the tools to be able to stand up and make a decision for themselves or for somebody else. Um, Things have changed dramatically from when the company started till now. In 2001, people would ask, why would I ever do this? This is weird. Why am I going to test? And companies like Fitbit have had a huge impact. People are used to tracking parts of their body, their steps, their health, their heart rate. So fortunately for us, a BAC is just another data point as part of their life. So that's a great trend that's helped us and I think is only going to continue and leaves the door wide open for really getting involved and providing actionable data to people. As part of what we do, we go to events. We're based in San Francisco. Super Bowl 50 was in San Francisco last year. So we had people go out in NFL referee uniforms and we tested people. And people did not shy away. People came right up and said, sure, test me. What is my alcohol level? Let me see what I am. Test my friend. So I would again say that maybe 15 years ago, we'd be in a corner and nobody would want to do this. But now people can come up and be tested and there's a more open environment towards it. Um, what we're hearing from customers is they want the latest technologies faster. That image there on the left, that's one of our employees blowing using our remote alcohol monitoring system. We started with iOS. People were all over us saying, hey, we want it for Android. Hey, we want a desktop portal. So we're working as fast as we can to get these solutions out there for people. My VP of marketing specifically told me to say, there's a YouTube comment for our wearable that says, shut up and take my money, I want this. So there's clearly demand from people that want these types of solutions. And finally, just briefly at the end, we wanted to share some ideas. Awareness is clearly part of it. People still lack basic knowledge about blood alcohol content, and we think that would go a long way. Everything has changed in the last 5 years with smartphone connectivity and telematics, so there's a tremendous opportunity there. And having friendly, social, realistic messaging. People have often heard the buzz driving is drunk driving campaign. We want to encourage people to think honestly and have realistic messages for people. Growing the public-private partnerships, those are important. That had a real impact on our company, so doing that with other companies I think could go a long way. And of course, pushing the technology development. There are going to be some amazing changes and some technologies that we're working on that I haven't even spoke of here that might relate to vehicle integration. So there are a lot of technology solutions coming up. Thank you.
Great, thank you very much. That's fascinating.